Last night, Metro Health reported 189 new cases. 13 new deaths were also reported. 7 of those new deaths have been verified by Metro Health, but date as far back as July. We are standing by for the live coronavirus update for San Antonio and Bexar County and hope to get new numbers.
Joined by Dr. Brian Alsop,
who's
the Chief Medical Officer of the University Health System, and this is our COVID-19 update for the San Antonio community. Tonight we are reporting 272 new cases of COVID-19, which brings our total to 46,083 in our community since the pandemic began. Our 7-day moving average is up slightly to 152, and so this is a stark reminder to make sure that we do not let our guard down, especially as we're getting closer to Labor Day and schools opening. We do unfortunately have 13 new deaths to report tonight, bringing our total to 780 confirmed and verified deaths related to COVID-19. 7 of the 13 are the result of Metro Health reviewing death certificates provided by the state and confirming the deaths were indeed COVID-19 related, and those occurred between July 2nd and August 24th. Over in our hospitals, for the first time since June, we are below 400 hospitalizations. There are 393 people in the hospital tonight, 49 new admissions since yesterday, 196 in the ICU, and 125 on ventilators. And keep in mind, especially with those deaths that were reported tonight and those folks who are fighting for their lives in the ICU and on ventilators, these are people's mothers, fathers, brothers, sons, daughters. Please keep them in your prayers. We have 62% of ventilators available, 14% of staffed hospital beds available, and the overall hospital system remains under high stress, but we are slowly moving in the right direction. Let me turn it over to Judge Wolf.
Yeah, thanks, Mayor, and I'm really optimistic about what's happening with the hospitals. We know that's current. We know that there's not any backlog on deaths, no backlogs on testing. This is current. And so to me, that's a good indicator that we are clearly moving in the right direction, and to see that numbers go down below 400 when we were as high as 1,267, that's just great news. But as we all know, we have to keep up our vigilance and make sure that we're doing everything else to protect ourselves as well as others. And there's some interesting things for you to think about as you go about doing that. The factors that affect this spread of disease are different. And it could be the air circulation within a building. It could be the ventilation in the building that may not be proper. And the time that you are around someone, usually it's somewhere about 10 to 15 minutes in terms of it spreading to you. How much of a crowd density do you have? And are people that you're with wearing a face mask? And the other thing I think to be alert about is this person quiet that you're with? Is he speaking softly to you, or is he shouting and singing? If he's shouting or singing, you better get a lot further away than 6 feet. It's shown that when they had that choir practice in Washington State early on, that it traveled as far as 45 feet when you're out singing. So keep these things in mind as you work hard to protect yourself as well as those around each other. And again, we touched on it just briefly time before last. We're into flu season coming up. It's important that you get your flu test, because of the flu is a different animal than what the COVID-19 is. They spread in different ways. They last maybe in different longer times in your body. And so while we have both of these coming at us, as we come into the fall of the year, it's going to really be important that you get your shots and that we continue to use the face mask. And if we do that, we could get through this flu season without another big outbreak of people passing away either from the flu or from virus. And we've shown that can happen in the southern hemisphere if people will continue to do the things that we ask you to do, the face masks, at least 6 feet away from each other, sanitation, stay away from inside density of crowds. So let's hang with it and let's keep these numbers going in the right direction.
All right. Thank you, Judge. And Now that the evacuation orders have been lifted in the Gulf Coast region, we want to thank all the volunteers and local residents here in San Antonio for stepping up and helping the Red Cross and really helping us ensure that nearly 5,000 of those evacuees made it here safely and were treated well. And as they depart back to their homes, know that we're with you, and we will continue to help our neighbors on the Gulf Coast as they get back, back to some normalcy, knowing that we are still in a pandemic as well. So, again, if you are looking for any of the latest information on COVID-19, you can go to covid19.sanantonio.gov anytime, or you can text COSA-Gov to 55000. Dr. Alsip, myself, and the judge are available for questions.
Given a decline in the hospital numbers, would you say, Dr. Alsip, I don't know if you want to start since we have you here, do we have a good grip on this virus? I mean, given that the ICU numbers are low, the hospital numbers in general are low?
I'm not sure I'd use the term good grip. I certainly would say we're all optimistic that the numbers have gone down. The trends have continued in the right direction. The hospitals are feeling less stressed than they were certainly in July. We do know what works, and I think the things that we've been doing for a long time now with masks and distancing and so forth have helped, but we need to keep using those measures, I think, for foreseeable future. We have, I think, a natural experiment getting ready to occur, not just here locally, but nationally with respect to the schools. We certainly after Labor Day, the holiday itself, as well as more of the schools are going to be having in-person presence, students and staff. So we're very interested in watching to see the effect of that.
What is your anticipation with the holiday and schools?
Yeah, I think certainly we're hoping it won't be anywhere near what we've seen before, because the biggest surge that we saw after Memorial Day, I don't think we were as vigilant as we are now. So hopefully we'll see less of an effect, but we're going to be putting people together in those environments that really haven't been in that.
This briefing is continuing right now at KENS5.com and our Facebook page. Let's get you up to speed on some of the numbers we just heard. 272 new cases of the coronavirus in San Antonio and Bexar County. 46,803 total have been reported since we've been fighting this virus. Sadly, tonight, 13 new deaths to report. Those all were recorded between July 2nd and August 24th. That brings us to a total of 780. Now, where's the good news? 393 people are in the hospital tonight. That is the first time we've been under 400 since June. So we are trending in the right direction as far as those numbers are concerned. Mayor Nirenberg with a thank you to the volunteers and Red Cross who helped all the people who evacuated the Gulf of Texas as we prepared for Hurricane Laura this week. Some of those folks are getting ready to go back home now as things are starting to begin to recover.